Coming up on Medwatch today, decoding history, how science is using your genetic background to help fight cancer both now and in the future. Moms, you'll want to hear this, a look at how doctors are able to handle each and every need for the tiny patients in Community Regional's NICU, and the efforts underway now to help educate and inform new moms and moms-to-be. It's a focus on having healthier babies born here in the Central Valley. Those stories and more right now on Medwatch Today. Hi there, and thanks for joining us. I'm Julie Musgrave. Your genes can not only tell you a lot about your history, they can also reveal about your present and your future. The science is being used now to help decode certain cancers. Here's a look. 3 years ago,
I didn't think I'd be alive today.
Cindy Farley received the heartbreaking news. She had colon cancer.
My primary concern was for my son. And what risk did he have, and what, from now on, what did he need to do?
Colon cancer can be hereditary, so it was time to take a closer look at Cindy's genes.
What I see as my job is, why did you get this? Are you at risk for anything else? And what about your family?
Dr. Dawn Delosier is a medical geneticist and counselor with community medical centers.
The flags for hereditary cancers are going to be young ages at diagnosis, multiple individuals in a family, or a person who's had more than one cancer themselves.
Genetic screening uses a blood sample to pinpoint those flags and see if a gene is responsible. Basically, find out why. It can be done for many cancers, including breast, ovary, colon, uterus, skin, prostate, even pancreatic cancer.
So we have 22,000 genes. There are probably over 200 that have something to do with cancer. So the first part is picking the right genes to test.
Dr. Delosier starts with a consultation. She goes over a detailed family history and a personal medical history.
90% of the time, it's not a gene causing your cancer. In 10% or less, a gene is either the cause or part of the cause.
If there's an abnormal gene, Dr. Delosier says that information can then be used for treatment options or preventive measures. The goal is to catch it early and find out who's at risk.
It's more about preventing future cancers in yourself and your family.
Which is exactly how the science benefited Cindy, her son, and the rest of her family.
Because I was diagnosed fairly early, what risk do they have and when should they be checked? So hopefully there's minimal risk for that generation just based on my genetic workup.
Cindy is still in treatment and starts more chemo in January, but she's hopeful.
I think there's a way in which we can thrive. We can learn and grow and thrive.
Knowing her genes can help tell a story that allows future generations to live theirs. Genetics could play a large part in the cancer care that community delivers in the new cancer center being built on the Clovis Community Campus, opening this summer. By having all cancer services in one building, the quality of care will continue to improve for patients. Caring for the tiniest of patients is a big job, and Community Regional Medical Center's NICU is one of the busiest in the state. Stephanie Bainham has more on how Fresno is well equipped to handle all things newborn.
Dr. Rajani, thanks so much for joining us. We know how busy you are.
Oh, my pleasure.
You are a neonatologist.
Right.
Tell folks what that is.
Well, a neonatologist is a specialist who looks after newborns, and that's essentially what the term means, just an expert in newborns. So this encompasses all forms of newborns, from premature babies, which is what people usually sort of associate us with, and also with full-term babies who sometimes also can fall sick for various issues, be it infection or congenital malformations or numerous other issues.
And so tell us about the NICU here at Community Regional.
So it's an 84-bed level 3B NICU, which is an NICU that's quite large, really, at 84 beds. And here we can take care of very, very small, super sick babies that are quite tiny. We can perform surgeries on them as well. And this ends up being one of the busiest NICUs in the state of California.
Yeah, and it's so great that parents should know that this is in our backyard because you do some miraculous things.
Oh, thanks. No, absolutely. It is an incredible resource, and I really do think that most don't realize that there's so much pediatrics going on at Community Regional, between the emergency department, the burn center, the NICU, our pediatric ICU, which has just turned 1. It's really a place where there's a lot of pediatric medicine that's being practiced. And it's an incredible resource because there are so many subspecialists here. With our affiliation through UCSF, we have subspecialists in myriad categories: cardiology, pulmonology, surgery, as I mentioned, gastroenterology, endocrinology, all these different areas which are important for the care of a baby and a child.
Yes, and you're helping babies get better every day. What's it like when you see them at NICU reunions and they're all healthy? That must make you feel good.
We really say that that's the time when we recharge our batteries, that being at the NICU reunion or graduations. This is when we see babies that were in the NICU sometimes for several months, and they come back and their families bring them so that we can also see how they've done and how they are, and all of the hard work and effort that you put in to help them come along. The nurses, our respiratory therapists, dietitians, social workers, occupational therapists, physical therapists. There's so many people who are all banded together to help these kids survive and have a normal, healthy, fruitful life. This is our time to be able to realize that that was worth it.
Wow.
And that's important.
Yes, it certainly is. Helping them survive, but also thrive, and you do that.
Yes.
Wow. Thank you so much for your time, for your expertise. And the message here is that your baby's in good hands, of course.
Absolutely. The message here is that we do this more than just about anybody. And what you do a lot, you can become and will become good at. And we have really, really taken a lot of pride in making ourselves the very, very best. We continue to strive to always do better. And we have a great, incredible team.
Yes, you do. Well, thank you so much, Dr. Rajani, once again. Appreciate your time.
Thank you.
Thanks, Stephanie. Coming up on Medwatch today, some Californians are taking part in a new health craze, raw water. What it means and why many experts are warning against it, saying it's definitely dangerous. Plus, see how far believing in yourself took one employee within community medical centers. This week's Healthcare Hero after this.